Question number 1. Which IV cannula size is most appropriate for a 4-month-old infant requiring routine IV fluids? The correct option is 24 gauge. Question number 2. The recommended cannula size for rapid blood transfusion in an adult is. The correct option is 14 gauge. Question number 3. For routine fluid administration in an adult, the most appropriate cannula size is. The correct option is 20 gauge. Question number 4. The correct angle for subcutaneous injection is. The correct option is 45 degrees. Question number 5. Maximum volume for intramuscular injection in deltoid muscle is. The correct option is 1 ml. Question number 6. The Z-track technique is most appropriate for. The correct option is intramuscular dark staining medications. Question number 7. For insulin administration, the appropriate syringe size is. The correct option is 1 ml. Question number 8. The appropriate syringe size for giving 0.3 ml medication is. The correct option is 1 ml. Question number 9. Which suture size is most appropriate for fascial laceration? The correct option is 6. Question number 10. The recommended suture type for internal organ repair is. The correct option is visceral. Question number 11. Which needle size is appropriate for intradermal injection? The correct option is 27 gauge. Question number 12. For venipuncture in an obese adult, the most appropriate needle size is. The correct option is 21 gauge. Question number 13. The correct way to dispose of a used needle is. The correct option is flash directly in shop's container. Question number 14. How often should IV cannula site be checked? The correct option is every 4 hours. Question number 15. For drawing arterial blood gases, the preferred needle size is. The correct option is 23 gauge. Question number 16. The maximum time a peripheral IV cannula should remain in place is. The correct option is 96 hours. Question number 17. For scarf vein cannulation in neonates, the appropriate size is. The correct option is 25 gauge. Question number 18. The appropriate gauge for an epidural needle is. The correct option is 18 gauge. Question number 19. For tuberculin Mentox test, the correct needle size is. The correct option is 26 gauge. Question number 20. The recommended size of suction catheter for 3.5 ET tube is? The correct option is 8 French. Question number 21. For routine venipuncture in adults, the standard needle size is? The correct option is 21 gauge. Question number 22. The appropriate size of urinary catheter per adult male is? The correct option is 16 French. Question number 23. For subcutaneous heparin injection, the needle length should be? The correct option is half inch. Question number 24. The correct angle for intramuscular injection in vastus lateralis is? The correct option is 90 degrees. Question number 25. For finger laceration, the appropriate suture size is? The correct option is 4. Question number 26. The maximum volume for gluteal intramuscular injection in adults is? The correct option is 5 ml. Question number 27. For scalp suturing in adults, the appropriate suture size is? The correct option is 3. Question number 28. For appropriate size of nasogastric tube for adults is? The correct option is 16 French. Question number 29. For IV cannulation in elderly with fragile veins, the appropriate size is? The correct option is 22 gauge. Question number 30. The appropriate needle size for insulin injection is? The correct option is 31